the machine from a skin tightening perspective. But just before I do, just very quickly, tell me, what do you want to get out of this session today? What do you want to know?
Well, I'd like to know age group at which it's most effective on, and also if there's any cultural, like any particular culture that is going to benefit more to the treatment.
Yeah. Anything else? All right. Just ask your questions throughout to Abbas. And I was actually thinking more of an overall perspective. Is there things you want to walk away from this session today knowing?
I think it's the effectiveness, and you don't want to put your name on the line if you know. You need to know what you're going to go and see the patient.
Yeah.
And that's very important as doctors.
So what you're saying is you want confidence that the machine works.
We need to know the patient expectation, or what's the expectation of the patients.
All right. Okay. Good. All right. We are going to go through all of that. Ladies and gentlemen, there's a doctor that I met at a workshop. I had a different speaker presenting about 2 years ago now, and there was a gentleman in the crowd, and it was Abbas, and he seemed to be able to answer more questions than me or the speaker could about this device. So I ended up engaging Abbas, and through that discussion I realised he is probably the most experienced user of this device in the country. He uses it across every possible application, surgically and non-surgically, and he gets extremely good outcomes with the machine. So I thought no one would be better to talk to you today. So ladies and gentlemen, if we could please introduce Dr. Abbas AL-TAIFF.
Good morning, everybody. Thank you for coming for this beautiful workshop, although it's on Sunday. What you saw, the video is beautiful, excellent. Do everything what that lady was saying, except one thing, don't help the patient. That's okay. Now, skin tightening and wrinkle reduction. Very important, you have to understand, this machine literally is painless. And I mean painless, it's really painless. Non-invasive radiofrequency procedure. And it tightens the skin beautifully and reduces facial rings in all skin phototypes. Going to your question, doctor? Yes, there is no exclusion. Any culture, any race, any skin type. No downtime or restriction to sun exposure. The patient comes to you in the afternoon, midday, highly sunny, and they go out with very minimal redness. As you know that our skin exhibits rapid turnover of cells. This process slows as early as our 20s. So the collagen will go less, and the majority of age-dependent changes that occur in our skin happens in the dermis, which can lose from 20 to 80% in thickness during the aging process. And that's normal, what we call aging process. And normal. This is the normal, like pre-treatment skin. You can see the depth of the wrinkles and lack of collagen. The handset that lady didn't mention is called Glide Safe, and it is really gliding safely and nicely and smoothly when you put the gel on the skin. And I'm talking about different sizes, not only one size, all of the sizes. It's a nice handpiece that will radio frequency energy deep into the deep dermal tissue. This is the collagen synthesis when it starts working, and then the collagen remodeling, which occurs, as she mentioned, 4 to 6 weeks after the treatment.
What's the outcome of building new collagen? What does that look like on the skin?
Well, number one, when they see reduction in the wrinkles, it's a very, very good rewarding to the patient and of course satisfactory to the doctor. And the first session, to be honest with you, is the most important session, that you have to spend time with the patient, talk to the patient, and of course document it with pictures, with photos before and after. And even if you want to do one side, take the picture and let them see the picture after that, after you finish the full session. So they can judge, is it worth it or not? And this is, and we will go through that hopefully in the coming Now, the monopole, it is, as you're quite aware, Pelleve is monopole. It's not quadrupole like the other machines. It drives energy deep into the dermal layer. And this is the Pelleve, and this is the bipole. You can see the heat goes deep into the dermal layer and into the collagen. Plus, the good thing about it, you have 3 different sizes. Usually, when you start treating a patient, you start with a small size to bring the heat of the skin to the, what we call therapeutic level, between 40 and 42. And then you change according to the area that you treat. You can change, for example, from 10 millimeter diameter to 15 or to 20, depending on the area that you treat. And this is a study done by one of the doctors here, and you can see improvement of the fibro architecture from here to here, to be more organized, and of course to be better than before treatment.
And what does that look like? Like when you have more structured collagen, what does that look like?
Tightening.
Yeah.
Tightening is wonderful result. Wonderful result. One of the good things that when you have improved the collagen, they feel fresher and younger. And all the pictures that you're going to see regarding the Pelleve, and of course the surgical part, it's all Pelleve by itself, and of course the surgical part by itself. There is no resurfacing, there is no botox involved, and there is no makeup whatsoever. So my slides are purely Pelleve and purely surgical part, section of this machine. Now here, it's a study. 3 doctors, they did a study and they followed their patients after 6 months. They saw about 93% of the patients, or the customers, we can call them, they have satisfaction even after 6 months, after only single treatment, which is not bad, to be honest with you. But the protocol, as you're quite aware, it is, 3 treatments, and then you do maintenance every 6 months, just to keep it as a kind of maintenance to the patient. This is how we treat. This is a treatment technique. Minimum of 5 passes per area, using a corkscrew motion. Use, as I said, 2 handpiece sizes. The smaller one to bring the temperature up to the therapeutic level, and larger handpiece for deeper penetration. And of course, you alternate between vertical and horizontal. Maintaining the temperature between 40 and 40 degrees for approximately 5 minutes. And yes, minimum of 3 4-weekly sessions. It's not 3 monthly, 3 like every 4 weeks you give a treatment, 1 treatment. This is the minimum. But you ask me, doctor, have you done every fortnight? Yes. But minimum 3 of a monthly sessions to be done. This is the first protocol that you start with. And you can see now, this is in action. See how beautiful. You put gel on you apply gel, and it comes with the package, of course, itself. And this is the handpiece, which is 20 millimeter. And it's like a very nice, soft hand massage, but of course with the machine. It's like, the hot stone massage. Very simple. And believe it or not, of course I don't have the video, 2 of my patients, when I treated them, and I was talking to them, and then I received no response. Then I put my ear, and they are snoring. 2 were sleepy when I was doing the treatment. So basically it's very relaxing, very relaxing.
Is that uncommon for aesthetic treatments, for it to be painless and comfortable?
Very unusual, to be honest with you. I do PRP, and Howard does the PRP, and I believe even if you put topical anesthesia, it's very painful. Even if you give them the Penthrox to breathe in, and it's painful, still painful, because it's painful. I can't do anything, it's the PRP.
Yeah.
But with this one, when they get treated, you talk to them, and they talk, and and then they relax. It's very relaxing. One of the patients I spent with her about between half an hour, because she wanted the neck and the head. And when finished 45 minutes, She said, oh, is that it? So she wasn't, in the mood of stress and anxiety. And it's very relaxing session, but in the same time effective. Here, as I mentioned, we have 3 handpiece size, 10, 15, and 20. And it goes all around the areas, the face, everywhere, including the neck and the eyes, very important, the teardrop, and of course the forehead. But one thing I have to emphasize, the temperature or the setting that you put on for example, on the cheek, different than the setting that you put around the eye, and this one different than the one on the forehead, because of the different amount of the tissues there, and of course the fat tissue and tolerance of the heat. For example, here, yesterday, one of the patients that you will see, or the customers, I went up to 70, level 17 in energy, to reach to the degree of 40, 42. While other patients, I get to 30, 35, 40, and I reach that temperature. So each person is different than the other. And yes, doctor, there is no limitation of age as you are an adult. I treated 18 years old, and yesterday I treated 75 years old. So there was no limitation of age whatsoever. Right. And one good thing here, when you have your nurse or dermatologist or a practitioner that has been trained, the company themselves train you, and of course you as a doctor, first you have to be trained yourself, and then you train your staff. I have my dermatologist, Mrs. AL-TAIFF, you saw her photo, and also she's a nurse. Basically, she can do that, and she can generate the money for the practice while you are doing certain other things like PRP, threads, and so on.
So it's a delegatable treatment.
Absolutely, absolutely. And of course, every now and then you go and give the protocol, and of course you see the patient before and after, you take the photos, and after that you introduce the person to the patient or to the customer, and then she starts treating. After finish, you take the photos, and she comes into the second session. Here, it's not my patient, but you can see it's post 3 treatments. Beautiful improvement in the crow's feet and the lower eye. This one, periorbital, again from different doctor. And you can see the wrinkles, the ridges below the eyes, and improvement also in the teardrop because there is improvement in the collagen consistency and the ground. Now, this one, the upper eyelid, beautifully, nicely smoothing up. This is my patient. If you can see here, one treatment post single treatment. Can you see how many wrinkles here? And how improved on the other side? And this is only single treatment. This is before the second treatment. Here, puffiness under the eye, improvement, 3 treatments, and this is 3 months after the 3rd treatment. Believe it or not, this picture, 2011, and every now and then, between 6 months to 1 year, this patient comes for the maintenance. Yes?
How does it work to improve the puffiness? You increase the collagen or the hyaluronic to sort of smoothen lines, I can understand, but how do you improve on the
Yes. The puffiness here is not related to the puffy area, it's related to the teardrop. Of course, if it is, let's say, cyst, you cannot do that much, unless, for example, for me, I do physiotherapy. I dissolve the excess fat. But here, it's due to the teardrop. When you improve the collagen, you even it up. And just take a note, like you can see the area here, very similar to the area here, but here has been improved, so it has been even up. So it works like a filler, but it is more natural. There is no needle involved. And it's quite a way. In that area, it's very vascular. If you apply a filler, you may have bruising and you may have unevenness, and that will give a lot of headache to the doctor to start. Now here, crow's feet and lower eyelid reality. What I tell my patients, like for example, you come to me and you ask the doctor, give me guarantee, what's the guarantee? What's my answer?
Okay.
What do you think? How much guarantee?
Zero.
That's it.
Okay.
Zero guarantee. Even if I suck 6 liters of fat through liposelection, I tell the patient there is no guarantee whatsoever, because I'm not your creator. The creator created you, and depends on creator and your skin and how to look after it. And one of the conditions I put to the patients and to the customers, that do not smoke in any treatment related to this. This is the worst thing. Okay. See, you can see this one here. Large pores. A lot of patients, if you start your aesthetic, they're, oh, what about my pores? And what about this? It's annoying. How to treat it? Of course, microneedling, yes, but it is painful because a lot of needles. You have microdermabrasion, you have chemical peels, and you have the good treatment, which is painless, is what Pelleve. This is, you can see it 12 months post the third treatment. And I saw this patient regularly. Still, the picture very similar to the 12 months. You can see the lactose, and they get satisfied. This is satisfied what? Because the effect is still there. And this is what the age of this is about 1.5 years since I did this treatment, and of course 12 months. What we're doing here, see for example, again, answering your question here, this is 12 months post third treatment. Can you see the jowling? And can you see the smoothness here? If you do not take the photos, you will not know. Documentation is very, very important. Yes?
So do you take the photos after every session?
Beg your pardon?
Like the photos, do you take after every session?
I prefer for myself, I take a photo before the first and immediately after.
Yeah.
Then I take the photos immediately before each session.
Okay.
So I see the progress, not just with the Pelleve, with any machine that I have, or with any treatment, like for example TRP. So to document the improvement. So basically when the patient comes to you after 12 months, like for example this lady went overseas, they came back, and then we take the photos, she said, can you show me like what is the improvement I have? And this is what it is. Alright? Because the patient wants to see results. Results are important. How are you going to convince yourself first, and you will be convinced that you did the right thing, is by documentation. And this is very important. Right. Now, again, an old lady, 78. We have a machine in our clinic called Visia, and I believe you know what's Visia, which is skin analysis device. And this is Visia 7, which is top of the range. This is a picture taken before. Unfortunately, the numbers are not that clear, but this is before and this is after. An improvement, anything, just generally speaking, anything below 50 needs attention. Anything above 50 is not that bad. You can see the wrinkles, 47 improved to 52. The texture was 56 improved to 59, and so on. So it tells you, it works from 0 minute when you finish. But to have the lasting effect, you have to have several treatments. When I show you the slide of these doctors, two plastic surgeons and one dermatologist who did the study, this is random study and it is independent from each other. But they show the effect of only one treatment may last up to 6 months. But if you say to your patients, you have to explain that you need minimum 3 sessions and minimum 1 month or 4 weeks in between. To me, sometimes I go 7 weekly,